want to start this discussion with the current atmosphere around digital health investments in Europe. Based on data by Dealroom, Sifted recently reported that in Europe, investments in health tech surpassed fintech investments in June. So that was quite a big news. And I wonder, what's your observation of the digital health space in the last year or two? Because in the US and globally, Rock Health and Startup Health detected a decline in funding in the first half of 2022 compared to 2021. So maybe, Michael, do you want to start? You've got quite a lot of investment experiences.
I think the pre-pandemic time, I think everyone was kind of understanding that changes have to come, but it was kind of just hard to justify clinicians and the users to get into it. And I think, for lack of better terms, with the help of the pandemic, I think healthcare professionals understood the benefits of getting into digital health from various positions, starting from the communication with the patients, starting from simple appointment making with patients, towards supporting them via telemedicine, towards then also getting into data, access to data, not only from their office. So I think that drive a big momentum over the last 3 years and during the pandemic time. And with every hype, probably I think we also learned where it is really helpful, where it has really impact. And I think what we're seeing at the moment is kind of really the realistic pathways of where does it really help and where it has really its benefits today. And I'm still sure in the future we're going to learn more on that pathway.
Simon, what's your perspective? Do you want to add anything to what Michael said?
Sure. Just to add on that, I think one important aspect that we shouldn't forget here is also the macro economy outside of healthcare, right? So take a step back and also look at the world economy and what's happening there. And then it kind of makes sense also that we see some data that is declining here and there, because that's just what happens throughout every sector right now. We cannot say that, for example, healthcare or every other sector is performing bad right now, because everything is performing bad right now. There is still a lot of money out there, and we can also feel this as a venture capital firm. But investors are a little bit more, they were scared a little bit more, let's put it that way, than the past 2 years. Because right now the world economy is there's not too much certainty around like it was in the last 2 years maybe. And therefore we might see a little decline and a slowdown or something, but it would never change our view as Aescuvest as well on where digital health and healthcare in general is moving in the next 10 or 20 years, right, as a long-term investor.
Mm-hmm. You described Aescuvest as a VC, but that's not how the company is usually described. So on the website, you describe yourself as a fintech company with a special focus on financing digital health care solutions. You're known as the crowdfunding equity platform. So can you explain a little bit about how exactly do you operate as a VC compared to other VCs? How do you differentiate on the VC landscape?
Right. That's a very good question and an important one, because we need to position Aescuvest here at the right spot. You've been talking about the crowd investing part, which is our past, right? So it's not Aescuvest what it is today. We don't do any crowd investing anymore, right? Aescuvest was founded in 2014, and we had quite a journey there, and we did crowd investing for quite some time. And we made the decision to move away from crowd investing to more institutional investors. And we've been very successful with this pivot already. We are very sure that this was the right decision. And I'm saying venture capital firm because that's what we do, right? We do venture capital investments, which are just the investments we do in the stage the company is in, right? But you're right, we're not a classical venture capital fund, because we don't collect the money from investors, put it into a bucket, and then we make our decisions where we put the investors' money, right? There's no black box like in a usual venture capital fund. With Aescuvest, our investors, they can decide by themselves in which deal do they want to participate. So we are a deal-by-deal venture capital platform. This would be the exact term that we can use as well, right?
Can you maybe just share a little bit more about how the crowdfunding worked before, and why did you decide to pivot from that? Because it does sound like an innovative, different approach to what we see.
Yeah, that's the problem, right? It always sounds good. Crowd investing sounds so fun. It sounds perfect, right? We democratize venture capital. That was the slogan, right? And it is something very nice, and it's a good thing to do, right? But then at the end, it's a business, and we need to function as a business, right? We need to create value for our investors and also for ourselves to sustain the business. And we've been trying this so hard for many years in the past, and it just didn't really work out. And let me tell you why. We're investing in a very narrow niche with healthcare. Okay, so we invest in companies like Vivior, right? So Michael will probably explain a little bit more about what Vivior does. And those are niche products. Not everyone knows about them, and they're super interesting and exciting, but it's not something that you can put usually on Kickstarter or somewhere else, where you can find some money from individuals, from retail investors. So people like you and me that just want to spend 250 euros, 1,000 euros maybe, for a quick win. It's not the product that you can capture with this kind of investing. So because of this, because healthcare is just not the perfect fit for crowd investing, we decided after many years that we should transition away from there and move towards the more professional investors that can also bring a lot more benefit, to be honest, to the companies that we have in our portfolio as well. Both ways work pretty good. Okay, they do. And the crowd investing was good as well. And it also made us invest in great companies like Vivior, for example. So we had successful deals that we did in the past, but we just decided, it was a tough decision, but we just decided at one point, if Aescuvest wants to be successful and grow as a startup as well, we need to make this transition away from the crowd investing to more professional investors.
Mm-hmm.